Hi everyone, and welcome to our event this afternoon. My name is Yusra Osman, and I will be the moderator for today's event titled Being Black as a Social Worker in Canada, a Black History Month and Social Work Month celebration. We'd like to thank the Association of Black Social Workers and the Canadian Association of Social Workers for supporting us in coordinating and planning this event. Before starting off with our panel, I would like to begin by recognizing that I'm speaking to you all from Ottawa, which is located on the unceded, unsurrendered territory of the Algonquin and Anishinaabe Nation. Any discussion taking place in these lands that touches on racism or marginalization needs to begin with a full and honest recognition of the first and ongoing racial and colonial oppression in our region. And it is essential that we continue to build, deepen, honor, and strengthen the solidarity between Black communities in Ottawa and the Algonquin and Anishinaabe Nation, and to uplift one another's communities. I also want to recognize the continent of Africa as the cradle of humanity. We extend our respects to all people who identify as African, Caribbean, or Black, and the immense contributions they and we have made in our world. We recognize that we are in the midst of the UN Decade for People of African Descent. And under the themes of this decade, which include recognition, justice, and development, we take the opportunity to reflect on our current condition in this country and continue to work with our allies towards making long-term improvements in the lives of our communities on these lands. I'd now like to pass the mic to Alexandra Zanis, who is the Social Policy and Communications Coordinator at the Canadian Association of Social Workers, to offer some opening remarks.
Thank you, Yusra, and thank you to our esteemed panelists. I am so grateful to be joining today, also from the unceded and unsurrendered territory of the Algonquin and Anishinaabe people. On behalf of CASW, we are so grateful to be co-hosting this event with the Association of Black Social Workers and for the ongoing relationship we have with the Association of Black Social Workers, who are continuing to do some of the most groundbreaking work in the field, including the release of the Afrocentric Social Work text, which I have linked in your handout widget. Also in your handout widget should be an event that we are hosting in coordination with the Pioneers, with the Association of Black Social Workers on the Pioneers. And it's really an amazing opportunity to come and celebrate. So I would encourage you to register for that event as well. This event, as Yusra said, is in honor of Black History Month and the contributions of Black social workers throughout Canada. And it's also in honor of National Social Work Month, which is held throughout March. So I just wanted to say a massive thank you, and we are so excited to be here today and to be able to host this event and co-host this event, and we are excited for future events. Just as a side for housekeeping notes, your certificate of attendance will be sent to you by email, and feel free to click any of those icons on the bottom of your screen, read the speaker bios, use the chat and Q&A function, engage with us and let us know what lands you're tuning in from, and just thank you so much for being here. With all that being said, and in the spirit of a beautiful, wonderful event, I am going to take myself offline. But thank you, and have a wonderful, wonderful panel.
Thank you so much, Alex, for your opening remarks. And as Alex said, thank you all for being here with us today for this discussion with 5 very accomplished Black Canadian social workers, many of whom are my friends and mentors. And before opening our event and as we go to the panel, I just really want to take a moment to acknowledge that as Black social workers, we know that we lead complex and multifaceted lives. When we talk about marginalization and racism that we face in our lives and in our work, it's really important to address that, and we work to acknowledge, challenge, and resist it. And especially as social workers, we know that our profession is engaged in the front lines of fighting against systemic barriers that our communities and that we also face. But with that said, it's really important that this conversation and others like it don't boil us down or oversimplify our experiences to simply being one of marginalization or even the important work of anti-racism. Being Black is such a beautiful, wholesome experience. We lead beautiful lives. We come from beautiful families, communities, our ancestors. So we're joyous about our accomplishments and strengths, and we're also passionate about the ways that our careers as social workers can change the lives of others for the better. And in moments like this, when we do talk about marginalization and racism, which is of course very important and necessary, we also celebrate and recognize the really the amazingness of being Black and of belonging to African, Caribbean, and Black communities. And so with that said, and kind of just outlining this guiding framework for our discussion, I'd like to proceed to the first question for our panel, which is, given your many successes and challenges, please tell us about a challenging moment in your career and how you overcame it. So all four of our panelists will have the opportunity to answer this question. And before each panelist answers, I'll quickly share your bios with them so you get to know them and their rich accomplishments as I have. So first up, we have Prince Will Ogban. Prince Will is a registered social worker and a graduate of the University of Waterloo's Masters of Social Work program. Prince Will has devoted his entire career in human rights, diversity, and inclusion, providing strategic advice to organizational leadership and diverse populations within government, private, public, nonprofit, education, and healthcare sectors. Prince Will's deep value for diversity and inclusion, which stems from his personal experience as a Black man, has successfully led him to develop policies, deliver programs, case manage complex human rights disputes, and deliver a wide range of human rights, diversity, and inclusion workshops and trainings that highlight the varied needs of different communities and promote organizational inclusivity across workforce, driving employee engagement and creating organizational diversity and inclusion success. As a diversity and inclusion specialist at City of Ottawa, Prince Will provide strategic advice in the development and implementation of diversity and inclusion policies, programs, and projects across departments that affect a workforce of over 16,000 employees. Thank you, Prince. I'll let you answer the first question.
Okay. You want to repeat the first question again, if you don't mind?
Absolutely. So the first question is, given your many successes and challenges in your career and the life that you've led, please share with us a challenge that you faced and how you overcame it.
Yeah, thank you very much, Yusra. I wanted to refresh the mind of the audience around the question. I know the introduction was long. I have a long bio anyway. So, well, it's very, very difficult as a Black person not to face challenge, especially in North America, because as Blacks, we know the history of colonization, slavery, and how it impacts our everyday life. You know, we see it in the form of racism, we see it in the form of microaggression, we see it in different forms. So my experience as a Black, as I said in my bio, have really influenced my life. But on one side, I would say it rather than making me feel very negative, it's made me move to the positive aspects of those experiences. An example of that is the current job I do. I used to be a clinical social worker, you know, working in a hospital setting. But with my experience of racism, I started navigating towards policy procedures and how to help organizations create a better work environment for employees like myself. And today I work as a diversity and inclusion specialist, and that's exactly what I'm doing. You know, and even in the course of this work, we see those challenges creeping in. But as a Black, you know, you just have to be perseverance, because it seems it's unending. And you have to, for me, I seek for allies, because a lot of times the people that have the power to make changes are not really people that look like you and I. We are there to provide those guidance, those policies, those suggestions. But it's only when you have allies that believe in you that some of the guidance that we provide comes to fulfillment. So that's one strategy that I've used. For Black social workers that are attending this event, I want to encourage you that you don't need to give up your career as a Black social worker because of what you experience. You should just learn from me and see there are 1 million ways that you can work as a social worker. You know, we can work in any organization, so you can be very creative in moving your experience into creating better opportunities for Blacks just like yourself. Thank you.
Thank you, Prince Will, for sharing that and for encouraging the audience. Among us, hopefully some Black social workers or Black individuals who are interested in being social work, and encouraging us to continue and find many of the million ways, as you suggested, to create a career. Next up is Allison Everett. So I'll introduce Allison and I'll repeat the question again so you can answer it. So Allison Everett joined the Carleton University Faculty of Social Work in 2018. Allison's primary role as the Master of Social Work MSW Practicum Coordinator. As the MSW Practicum Coordinator, Allison oversees all aspects of the graduate field education program. In addition to her Practicum Coordinator role, Allison is an instructor at the school. With over a decade of experience in social work practice, Allison has taught a range of practice-based courses. Allison's teaching has provided students with a transformative learning experience that addresses anti-Black racism and other intersecting oppressions encountered by marginalized groups. For Allison, the creation of spaces for conversations about race and culture is an essential element in the student and educator relationship and foundational for developing honest and collaborative working relationships. Besides her teaching and field placement responsibilities, Allison has been an active member on multiple committees at Carleton. For the past 3 years, she has served as the founder and chair of the School of Social Work's Black History Committee. She also serves as a member of the Equity and Inclusive Communities Advisory Committee, the Racialized and Indigenous Faculty Alliance, and co-chair of the Field Education Committee. Allison is motivated by the strength of her community and believes wholeheartedly in centering the lived experiences of communities in order to create equitable change. So Allison, again, the question is, given your many successes and challenges, please tell us about a challenging moment in your career and how you overcame it.
Thank you so much, Yusra, for that lovely introduction as well. Thank you so much to CSW for having me, and I'm extremely delighted to be here. So as Yusra mentioned in my bio, I originally began my social work career in direct practice at a local community health center. And there I completed a variety of different activities ranging from, biopsychosocial assessments, implementing a range of equitable social and clinical interventions that enable people and communities to increase their control over their lives and to improve their health and ultimately to reach their full potential. And through collaboration with the communities that I did serve, I was able to design a range of culturally responsive activities that built the community members' structural capacity so that programs can be self-sustained by community members once social supports had ended. Most importantly, my approach to direct practice was around, the interventions were designed to look at the multiple ways that social identities overlap, thus creating compounding experiences of discrimination when it came to my clients accessing resources. So in my direct practice role, I was pretty much working with people who looked like me and also represented the diversity of the community. And as much as I enjoyed my direct practice role, I wanted to create more of a direct impact in the social work profession and decided to shift my scope of practice to social work education. So yes, that sense of comfort and belonging that I felt while working in the community changed dramatically for me when I moved into my faculty role at a post-secondary institution. So, being one of a few Black faculty members in a post-secondary institution, I sometimes felt alone, and I even found myself questioning whether or not this was for me. And how did I overcome this? It was through my faith, the support from my community, family, and mentors who reminded me of my value. And I think about people like Dr. Wanda Thomas Bernard, who opened the door for people who look like me. She encouraged me and acknowledged the work that I was doing and gave me so much hope and determination. So I can't say this enough, but mentorship is very, very key in being able to navigate these spaces as Black social workers and overcoming these systemic challenges. So, look for people who motivate you and who are genuinely interested in your growth. And do know, similar to what Principal was mentioning, your mentors may not necessarily look like you or share the same experiences, and that's okay. again, it's about seeking out those outlets where you can have these honest conversations around some of the challenges of navigating these spaces as Black social workers.
Thank you so much, Allison, for that inspiring answer and for really putting into perspective and just out in the open the experiences of Black social workers moving from frontline to an institution and what that might feel like in terms of isolation or not having anyone to turn to. So thank you for sharing your personal experiences and for offering some ways that people who may find themselves in similar situations can overcome and also find some support. That's really important, as you said, that we find those supports and not have to go through this alone. Thank you so much. And next up is Alicia Bromfield. So I'll introduce Alicia and then read the question again. Born and raised in the Ottawa area, Alicia accepted an NCAA Division I scholarship to play soccer at the University of Missouri-Columbia. She graduated with her BSW in 2011 and moved back to the Ottawa area where she began working in a group home for youth-aged males. In 2012, Alicia was hired by Family and Children's Services of Lanark, Leeds, and Grenville as a child protection worker. Alicia was then accepted into Carleton's MSW program in 2014 and graduated in 2015, at which point she returned to the Family and Children's Services of Lanark, Leeds, and Grenville. In 2019, Alicia accepted a full-time position as a social worker in the Ottawa Hospital Psychiatric Emergency Services Unit, which is a position she currently holds. Thank you, Alicia, for joining us today. The question again is, given your many successes and challenges, please tell us about a challenging moment in your career and how you overcame it.
Thank you for having me. So to answer that question, it had been 2 to 3 months into my social work career. So I was working for Family and Children's Services in a predominantly white community. And I met with a family and went back to the office and received information that they no longer wanted to work with me because of the color of my skin. That had been obviously the first experience as a social worker where I was faced with that, and it was hurtful for me. I didn't really know what to do. Spoke to my manager, and the family ended up going on with a different worker. But how did I overcome that? A lot of self-reflection and looking inward, and really addressing how that made me feel. What would that look like if that were to happen again? And speaking to those that I trusted. I'd have to say that, that haunted me for quite a while, walking into someone's home and having that fear of you're not going to be accepted because of the way that you looked. So there was a lot of work that had to be done around that to accept that and how to respond to that. So I think that was probably a pivotal moment in my career to know that that's something that can happen and that I was not prepared for. Because when can you ever be prepared to deal with that? So that was quite difficult.
Thank you so much, Alicia, for sharing that. And I think everyone on the panel today and those of us who are listening in can absolutely relate to that. And as you said, we are oftentimes blindsided by it. We are confronted with racism or other forms of marginalization many times as a young child. That's when we first experience our racism and we learn what it means to be Black in this context. And to confront that in our workplace is really, really challenging and unfortunate. And as you mentioned, in the ways that you try to overcome it, it does take that self-reflection, it does take that thought, and hopefully reaching out to those around us that may support us in our organization or in our community, and really just finding ways to talk about it and put it out in the open, and hopefully in the future find ways to confront it directly in our workplaces, and knowing that it is not something that will be tolerated from our clients and those seeking services. So thank you so much for sharing that. I think, as I mentioned, is something that we can all relate to as social workers working in these institutions. And last on our panel is Jamila. So I'll introduce Jamila to you all, and I'll ask the question once again before she answers. Jamila is a mother, registered social worker, advocate, clinical social worker, clinical counselor, and equity and anti-racism consultant, coach, and facilitator. Jamila is a senior equity advisor at Boys and Girls Club of Ottawa. She holds a bachelor and master's degree of social work. Jamila developed and facilitated the first Black youth support group in Ottawa through Jaku Konbit. She is the co-founder of the Ottawa Region African, Caribbean, and Black Social Workers and Social Service Workers Network Group and sits as a director at the Sankofa Consultants Group. She believes that humans thrive when they are supported, thereby she favors a collectivist approach. Jamila utilizes an Afrocentric paradigm, trauma-informed lens, and a healing-centered approach while working with individuals, families, and groups for a holistic practice. Thank you, Jamila, for joining us today. The question again is, given your many successes and challenges, please share with us a challenge that you faced in your career and how you overcame it.
Thank you, Yusra. Thank you for having me. Okay, so I'm a storyteller. I love to tell stories, but I'm going to make sure I don't take everybody's time. I have had a lot of experiences and challenging experiences as a social worker, but I would pick one. I think that one is a lot more recent. So it's basically based on how I present myself as an Afrocentric social worker. Just like you've heard from my bio, I'm not afraid to say that I'm an Afrocentric social worker, and I'm happy to always, explain to folks what that means. I had an experience with another social worker, actually, who questioned me many times during one of my practicums. And said that I was using, they thought I was using a very limited view or limited social work lens in trying to support students. And so when I asked what does that mean, what did that look like? Basically this person said that, well, if you're only looking at like how their experiences around race and discrimination affects their life, then you're not really doing your work as a social worker. And so I had to basically explain that Afrocentric social work doesn't mean that you're only looking at one lens. It just means that that's another added lens that we have to look at. And most social workers, most institutions systemically don't look at people through that lens in a holistic manner. And it almost felt like I had to defend myself. And this situation happened many, many times. And I think for me, I was very surprised because this was coming from another social worker. And I thought, okay, maybe because, they don't understand the worldview. I would explain it. So I basically use it as a teaching moment to explain what Afrocentric social work means. We're looking at, folks through their own ancestral knowledge, through the history that that our folks have experienced, through whether it's migration, mental wellness, community support, personal support, how they're experiencing institutions and in their personal lives and in personal interactions with other folks. I said it has to be a worldview. We have to make sure that it was a holistic way that we look at folks, and race does matter. It makes a big, big difference when we actually add that as another lens. But at the end of the day, the social worker would tell me, "Oh, I think I understand what you're saying. Did I tell you that I have a Black friend?" So it was a very microaggressive experience for me. And because it happened a few times, and I did call them in to explain, this was how I was experiencing the questioning. And I'm happy with, sharing knowledge and learning together. But it was becoming very difficult. And I started recognizing that it was actually affecting me as a person mentally. And I had to actually take myself away from that setting. So I basically had to, advocate for myself through my school. to say that I needed another practicum place. And it was met also with a roadblock because, you know, I was told, well, you're basically almost halfway there through your practicum. We can't really take you out. And I had to basically advocate for myself that no, as social workers, we have to be able to acknowledge when, you know, a space is not conducive for us. It doesn't feel safe. And I've done my own part in trying to make it a safe enough space for me and for the student that I'm actually trying to support. But it's not working. I know when I can control things, and I know when I can leave it. So it took about a week, but I also found an ally in one of the professors that I had, and they basically used their privilege and power to get me out of that practicum and to advocate for me from the dean, basically, so that I was able to be put in another space that was more conducive, and I was able to flourish in my learning process and journey. So that was how I navigated, and I would say kind of overcame it, because I wouldn't say I overcame that, but I would say I survived it and navigated, because it is an experience that I continue to have in different spaces as well. And also, as you know, when I work with other organizations that are predominantly westernized. So yeah, that's my little story. Thank you for listening.
Thank you, Jamila, for sharing and for your honesty, and everyone else who is here on our panel today. I think hearing from you all, it really speaks to the challenges we face day in and day out, whether it's personally, you know, interpersonal relationships with our colleagues or our managers, whether it's client facing, or whether it's the institution or structure in and of itself. And I really heard from you all the bravery and just addressing and confronting it, of challenging it, of finding ways to overcome it, of reaching out for support. And that's, you know, the real wholeness of us being Black in the communities that we come from, and how we face these experiences and find ways to survive it the best that we can, and hopefully come out in the end flourishing and stronger for it. So thank you all for starting us off with this first question. Now we'll move on to the second part of the panel, which is specific questions related to your experiences in the field that you work in. And as the audience has heard, you all are coming from very specific disciplines. And right now, we'd love to hear about that specifically. So we'll start off with Prince. So Prince, the question for you is, despite the Employment Equity Act, systemic racism continues to account for underrepresentation of Black people, especially in leadership positions in the Canadian workforce. From your work as a Black structural social worker and someone who does work at the City of Ottawa, what can organizations do to address this? You're on mute, Prince.
Good. Can you hear me? Okay. I say thank you very much, Yusra, and thank you, Senator Wanda. Senator Wanda was actually the brain behind this event. We've spoken about Association of Black Social Workers in Ottawa for a while. This question is I'm very passionate about this question. As Yusra says, it relates to what I currently do. For those who don't know too much about the Employment Equity Act, actually the Employment Equity Act was established in Canada in 1986, and it requires government employers to engage in proactive employment practices to increase the representation of Aboriginal people. I'm using terminologies that was used in the Employment Equity Act. So Aboriginal people, I know Indigenous is a more preferred terminology. Then women, visible minority, and persons with disability. And the idea is to remove barriers to employment that disadvantage members of this group. To be very sincere, all through my practice in social work as a clinical social worker, I never heard of the Employment Equity Act. I heard of it when I moved towards structural social work. So most Blacks don't even know something like this exists. And why don't we know? Because a lot of organizations don't even follow this act. They don't implement it. So for this act to be successful, one, organizations are required to capture data. So you want to know the workforce representation of your employers out in these 4 groups first. Then secondly, you want to set targets on from that data, you know, areas that you don't have enough representation, and set targets on how to improve on those areas. But this act, as we see, it was established in 1986, and I think the act need to be reviewed. And why do I say this? Visible minority, blacks are lumped into visible minority, and you know, after indigenous people that really experienced colonization, the next set of people that experienced colonization and even experienced slavery, transported from transatlantic ocean and sold, are blacks. So I find it very disrespectful that blacks didn't have a separate column in the Employment Equity Act. And just because of that singular mistake that was made in 1986, it's been very challenging to address issues around employment for blacks in Canadian workforce, because what happens is a lot of organizations that even take this data don't take disaggregated data, so they don't actually know. They have numbers of black employees working in the organization. They have that of visible minority. So with that, it's very difficult to address the needs of black, or to even understand the gaps around black representations when you don't capture that data. And most organizations that would reference to the Employment Equity Act, we're only capturing data and groups that were mentioned in the Employment Equity Act. We don't want to go beyond that. And that act, we don't have blacks there, you know. So that's a big issue there. So one way we can improve this is for advocacy. You know, there's been in my workplace, I've been advocating that we have a desegregated data, so that would have blacks, so that we're able to capture blacks. And in the city, in the Vision 3 of our Count Me In, we have Count Me In questionnaire, which is something that we launch with city employees, so that people can self-identify and we can know the representation of our workforce. So because of my advocacy and advocacy of other people that look like me within our workforce, in the Vision 3 of that Count Me In survey, which is going to be launched late 2022 or early 2023, there's going to be an opportunity for people to respond to questions around race and blackness. So you can actually respond and say I'm black. So that would allow the city of Ottawa to know a representation around blacks, and would also create that opportunity where we can start addressing systemic racism that have affected black representation in workforce over the years. So when it comes to black being in leadership, I think there are 2 things that you have to do. We need agency. You know, when I mean agency, in the city, we've been able to allow groups, register affinity groups. We are different groups that share the same identity. Groups of individuals that share the same identity can come together and form a group and see how they can share the experiences within the workforce, and also promote things that will promote the interest of their groups. So we want to see blacks have been involved in things like that within workforce. We want to see blacks, especially those in leadership, to mentor blacks. Is another thing that we really don't have a lot within our black population. We don't share a lot. I don't know if it's cultural, like if a black person is having challenges at work, they find it very difficult to share with their fellow blacks or colleagues because of shame. But for me, from my personal experience as a black person, I've grown to that point that I encourage blacks. If you're having a challenge, no matter how little it is, share it with your black colleagues, especially those in leadership positions, so that they can know how to mitigate those challenges. Because it's very easy for blacks to be pushed out of the workforce than any other race. So we're kind of in the bottom when it comes to racism. Blacks get the highest impact. So we need that agency. And for those in leadership, you want to create an environment within your workforce where blacks that are there, that are not in leadership position, will be comfortable to come up to you to share their experiences, and also come up to you for mentoring. So these are areas that we can work on to bring that Black leaderships into those positions. Because when there's mentoring, there's more opportunity for Blacks to grow up the ladder as well. Thank you.
Thank you, Principal, for that great answer and for bringing two very specific things to light in this conversation as we talk about, you brought up data equity and the importance of disaggregated data and really not lumping in the Black experience with other racialized groups or, in the context of the Employment Equity Act, visible minorities. And as you mentioned, we recognize and we know firsthand that anti-Indigenous racism is foundational globally. And alongside that is anti-Black racism. So we have to pull that out as a separate and unique experience. And hopefully with the disaggregated data movement and people understanding it and really pushing and acknowledging that we need specific race-based data around the Black experience and workforce, hopefully that will bring to light some changes. And I always kind of think of it as we can't change what we can't measure. So if there's no measurement of it, we can't advocate for that change. So, and I know as a former colleague with you at the city that you're doing a lot of work behind the scenes to support and advance that. And also thank you for bringing up the isolation that Allison also spoke to earlier around working as a Black person in these institutions and in these structures. We often feel alone and isolated, and really doing what we can to reach out for support is really, really important. So hopefully changing what it is like to be in the workforce. So thank you for sharing that. Next up, we would like to hear from Allison, her specific and unique experience as a Black faculty member. So Allison, your question is, as a Black social work educator, what has been your approach to supporting Black social work students and prospective students? How have you fostered an affirming space of learning and growth for them?
Thank you, Yusra, for your question. Oh my, where am I going to start? I would like to begin with my experiences as a graduate student. So I can recall when I completed my social work graduate studies, which was a while ago, and I'm not going to tell you exactly when because I don't want to date myself here. I was one of two Black students in my cohort. And I always felt and found that I was the one student who had to take on the onus and responsibility of addressing non-Black students' problematic and racist behaviors and comments that were usually shared during classroom discussions. And there were multiple issues or layers of microaggressions. And was this a difficult time for me? Absolutely. I couldn't wait to complete my MSW. I was literally counting down the days and hours for my degree to be conferred. And now, as a social work educator, I feel it is my responsibility to ensure that this experience is not duplicated and that all students feel represented in the curricula. So for me, in my classes, as I mentioned, I like to provide students with a transformative learning experience that addresses topics such as anti-Black racism and the other intersecting oppressions that are usually encountered by marginalized groups. How do I do this? I try to be creative with the assignments and offer a variety of approaches to experiential learning. So, this could be in the format of theater, slam poetry, and other forms of creative arts. Also, I do ensure that course readings draw from diverse writers, and there are also elements in the readings that show other forms of social work practice, such as Afrocentric social work and best practices to decolonizing social work practice. In addition, in my classrooms, I believe the creation of spaces for those honest conversations about race, diversity, and culture is absolutely integral in the student-educator relationship, and it also helps to prepare students on how to engage with diverse communities upon completing their studies. And, most importantly, I encourage students to think differently about the social work profession and encourage them to think outside of the box and help to decolonize their minds. So, kind of moving forward to where we are currently, I do recognize, however, that there has been a significant shift in social work education where institutions are working really hard to address the gaps relating to equity, diversity, and inclusion in the academy. And one of these overarching themes is in recruitment and retention of Black, Indigenous, and racialized students. So, as I recognize my privilege to be in the academic space, I take significant pride in my role, and I'm continuously looking for ways to increase student representation and break down those barriers to accessing post-secondary education. So this has included initiatives such as, doing active outreach in underrepresented communities and high schools, seeking out field practicum placement opportunities with agencies that have an EDI focus, mentoring Black youth who have an interest in the social work profession. And I've also co-collaborated on the creation of an entrance scholarship for Black, Indigenous, and racialized undergraduate social work students, as well as you mentioned in my bio, I have founded and chaired the School of Social Work's Black History Committee, where, this committee's primary focus is to design events that discuss the history of the social work profession and its presence in Black communities. And most importantly, it's giving students an opportunity to see themselves represented in the curriculum as well as in the School of Social Work. So, aside from my field and teaching responsibilities, these are items that are prioritized as it's important to create a cohesive infrastructure that supports these communities and the students. So therefore, we are able to, or at least I know that I'm able to ensure optimal success when the students enter into the program and complete their social work education. Thank you so very much, Yusuf, for your question.
Thank you so much, Allison, for such a thorough and really nuanced answer. Just to share with you all, I also teach at the School of Social Work, and it was Allison years ago that brought me in. She said, I know someone who can teach this course, and it was me. And so I looked to Allison as a mentor and a really close friend, and can really speak to the work that she's done at all levels to encourage and empower current students and prospective students. Before the pandemic, Allison and I went to it was actually Jekyll Convict with their Black history class that they have on the weekends for Black children and youth. And we spoke to them about social work and the university program. And many of them said that, they never met a Black social worker, and to have two of us right in front of them was so meaningful. And that really speaks to the ways that Allison supports students from the front line all the way to the students that are right in her classroom. So thank you so much, Allison, for sharing all the ways that you continue to work beyond your role as an educator and really being a community advocate and encouraging our youth to enter this profession. Thank you so much. And next up will be Alicia and Jamila. So the question is the same for you both, as you both work in clinical settings. And so I'll read the question and give Alicia an opportunity to answer, and then I'll read it again to hear from Jamila. So the question for you, specific to the clinical setting, as I mentioned, is, according to Ottawa Public Health, Mental Health of Ottawa's Black Community Report 2020 indicates that there's a lack of trained mental health care providers with cultural competency lens, which, quote, makes Black people feel misunderstood, misjudged, and sometimes misdiagnosed. As Black mental health social workers, how best will the system address issues that continue to create these health disparities, or if there are any ways that you've been able to do that work on your own? So I'll pass it to Alicia first.
So from my point of view, I think representation is huge, and there have been countless times where I have went into a patient room and I've gotten the sigh of relief from a Black patient. I don't have to go into depth about certain things. You understand. There's that comfort and just some sort of trust there when they see that it is a Black clinician that they're meeting with. I look around and I don't see a lot of physicians or psychiatrists who are Black, and I think representation is extremely important. Yeah.
Thank you, Alicia. Absolutely. And I think for those of us who do work in clinical settings or have, and I know many of us do, as Prince and Allison were mentioning before, that, we switch around and we move around the social work career to really develop our skills. One thing that we often notice, especially in this context of Ottawa, is the major gap when it comes to doctors, nurses, social workers who are serving the Black community. And oftentimes, perhaps in a community health center where many of us may have worked or done a placement, we witness that. But as you, Alicia, you had your experience in a rural setting, that's completely different than what you may have seen in a local or more central community health center or a hospital. And I think you continue to witness that really speaks to the importance of the work that everyone here is doing, specifically as Allison just spoke before you, really encouraging our community and our youth to enter this work and to really show them that there's a place for us and that work means something. And also what you spoke to, which is I know many of us can relate to, is that we enter the office or we call the client into the room, there's this huge sigh of relief and there's a huge discomfort that comes, and the fear and the worry that they were anticipating to how they might explain their lived experience, how will they explain their symptoms, how will they explain how they're feeling, how will they ask for help. It's really unfortunate that our community and even ourselves, when we enter the health system, we have to consider, will we be dehumanized, or will someone understand us and will they offer us the care that we need? I think advocacy is really important in that we support our clients in advocating when that care isn't there, and also finding ways to support and listen. And thank you for being honest and really just saying it is really about representation. Jamila, would you like me to read the question again for you?
No, that's good. I'm good. I'm just going to touch on some other things. I would say we need to definitely reduce barriers to access to services. Many folks who live in underrepresented neighborhoods may not actually have easier access to mental health support. Another thing too would be within the African Caribbean and Black communities, there is awareness around mental health because it is mainly seen as a westernized framework. It's for lack of a better word, people would say, well, it's kind of like what white people do, not what Black folks would do. So having people who look like them, who understand their experiences, go into the communities, meet them where they're at, so reduce that barrier to access and go in and, have an awareness type workshop or gathering, and not make it, again, westernized. I think a lot of folks, I wasn't born or raised in Canada. So for us, it would be, we come together, we eat, we talk, we listen to music, we sing, we do whatever and dance. And then we chat about what is important that day, right? So this is the kind of spaces that people like African descent folks will come together in a non-threatening space to discuss about mental wellness and the importance of mental wellness, just like we put importance in our physical wellness. Another thing is also to improve, mental health training competency, because even just for Ottawa, we don't have many African descent social workers, clinical social workers, or psychiatrists or psychologists. So, I know I do receive a lot of requests to take in clients from the ACB communities, but I may not have the capacity to do so all the time. We can be able to build the internal capacity of other social workers and psychologists who may not necessarily identify or be from the African diaspora, right? And I think we don't need to know everything about a certain culture or tradition to be able to provide effective and sustainable services to folks that are not from the same demographic as us. So that is where that training will be helpful. And in terms of training, I think folks need to start with humility. Like cultural humility is really important, because once we have the awareness that no, we don't have to know it all, but we can actually create safer space where we can ask questions, allow the clients to lead the session, allow them space to be authentically themselves. And if you don't know something or you're not sure, ask them. It is best to ask than for you to assume, because then you're just, creating more trauma and struggles for them. And also, we need to be able to, as institutions, create policies that are equitable, with using an anti-oppressive and anti-racist lens, because a lot of folks they take it more important and serious when it's written in paper. When it's got to do with your job and it's very important and it's written there, like you have to make sure that you're acting a certain way or you're thinking about these different perspectives, or you're reaching out for support, or you're making sure that you continue learning, and you're being intentional and mindful in your approach. Folks then will take it seriously, right? Another thing too is like smaller organizations. So for example, Jackal Combat, when I used to work there, they receive very, very minimal funding for very specific culturally responsive support for African, Caribbean, and Black folk in Ottawa. So this is where, provincially or federally, we need more funding that is actually sustainable, and to provide appropriate support to ACB communities. And of course, there's a lot of work that needs to be done when it comes to prevention and promotion, right? So some of it is that awareness raising within the communities. And as like Principal said, collecting race-based data. We need to know who are the people that we're serving, what are their help-seeking behaviors, where would they go to usually for support, how can we then collaborate within those spaces to make sure that, if we can't reach them because of, for example, fear or lack of trust, then we can go to those spaces where they already have that foundational trust, where they feel comfortable, collaborate with those folks. It could be the mosque, it could be a church, it could be, a community health center, it could be a community house. Collaborate with those folks so that you can actually bring services to the folks that we're trying to support, and then at the same time reduce that barriers to access, right? So you're actually meeting folks where they're at. Yeah, I think I will stop there. Those are just a few points in terms of how we can actually address the system and create better access and support for folks.
Thank you very much, Jamila, for the thorough answer. I think you spoke to all points and touched on the representation that Alicia was bringing up. And I know something that I was thinking about when you were answering was oftentimes as Black clinical social workers, even if a client might not be African, Caribbean, or Black, but they do experience some form of marginalization, they actually would like to see someone like us too, someone who quote unquote gets it. So it's not only ACB clients that we're supporting anyone who has that parallel or, intersectional experience. And that speaks to how much more we are overworked. We really do so much more than our roles are listed, what's on the job description. We work so beyond that to really support all individuals. And I think what you were sharing speaks to that about capacity building. So how do we ensure and how do we support people who might not identify like us to support everyone and not just those who look like them? And then also, how do we can support our communities outside of these institutions? You spoke to what it's like to care for one another outside of the office, outside of the clinical room or virtual room at this point. And I think that's really powerful. That reminds us that we don't always have to use the Eurocentric or Western modalities of healthcare or support for mental health to take care of one another, take care of ourselves. There's so many other tools that we have that we've gained from our communities, that we've gained from knowledge being passed down through generations, and that's something that we can continually access and to support our clients or those around us, to remind them that we have these tools at our disposal, and everything else that you spoke to, which is so important around data and also around removing barriers and sustainable funding. So thank you so much, and thank you all for speaking to your direct experiences as social workers in the public sector, in university, and as in education, and also in the clinical setting. The last question that we have for you all is for everyone to answer. It's the same question. It's really to allow us to end and move towards a kind of a strength-based perspective. And it's really about something we've heard from all of you today, which is about connectedness and the connectivity that we have as a Black community, broader Black community, and also in this community of Black social workers. So the question is, how can we come together as Black social workers to support one another? You can speak to what's already been done. You can speak to your experience and what you've noticed, or any ideas that you may have. So I'll start off with Prince.
Thank you, Yusra. And I want to first of all start off by thanking Senator Wanda. For some of us who don't know, Senator Wanda is the founding member. Actually, she came up with the idea to start Association of Black Social Workers, and it started in Halifax, Nova Scotia. And Senator Wanda was also my professor. She was the first Black faculty to teach me in Canada, and also a mentor. In the process of that teaching, she became a mentor in mother. I call her my Canadian mother. And I'm not the only one Senator Wanda has mentored. She's mentored both whites, Blacks, people from Middle East. She's mentored a lot of people whom I know as well. And so Senator Wanda, when she became a senator and came to Ottawa, she started having this discussion with me around. I moved from Nova Scotia to Ontario too. I was in Hamilton then. We started having discussions around how we're going to start Association of Black Social Workers in Ontario. Because in Halifax, the Association of Black Social Workers done tremendously well. They've provided that agency for Black social workers, so they've reduced the isolation that Black social workers and Black clinicians, not just social workers, Black clinicians face in the work setting. So there's this support that they get from that association. There's always a program, there's an event that touches on things like that. There's an opportunity to speak with other Black clinicians or Black social workers to learn more. And a lot of programs that they do, both in collaboration with the universities in Nova Scotia, in collaboration with the Nova Scotia Health Authority, in collaboration with even school board. I remember working with Association of Black Social Workers and going to a school board in one of the rural areas in Nova Scotia, in Windsor, to go support a high school student that was feeling isolated in school through the Association of Black Social Workers. So, and through this, they've been able to create that. They are well known and they have credibility. So the access funding, I don't know how much fund they access, but I know they have access to applying and getting funding as well. So I thought we really need something like that in Ottawa. Sometimes we can be very busy, but it's a good thing that we start an Association of Black Social Work Ottawa chapter, and so that we can support one another, and when we need that support, and also create that platform for mentorship, create that platform for networking, create that platform for funding, applying for funding to support issues that addresses experiences of Blacks all through the social work spectrum, both mental health, both primary health care, in education, just anything that affects Blacks. So we're in that position, we're in a better position to start this association in Ottawa. And also, we are very lucky that in Nova Scotia, the Association of Black Social Workers in Nova Scotia are very strong. And I believe that through Senator Wanda, we'll get all the necessary support and resources we need from the Nova Scotia chapter. So we wouldn't go through what they went through. We'll just tap into their resources and move very fast. Thank you.
Thank you so much, Prince. And absolutely, creating that association will really just formalize the relationships that we already have. You know, all of us on this panel, we know one another, whether it's from someone that we mentored or yourselves being a mentor, or working together or connecting together informally. These relationships really exist in Ottawa, and it's just about coming together really as a group under an umbrella and under the guidance of the Nova Scotia chapter, which would be really wonderful for all of us here. So next up to answer that question is Allison. So Allison, again, the question is, how can we, as Black social workers, come together and support one another? And you can speak to anything that you've seen that has happened and that you'd like to acknowledge, or other ideas that you may have and what that can look like.
Great. Thank you, Yusra. So yeah, I just would love to echo my colleague, Princewell, about Senator Wanda Thomas Bernard. Senator Bernard is someone that I truly admire, and every time I do get the opportunity to see Senator Bernard, I'm literally just running towards her to give her this big hug because, like you, Princewell, she is my second mother. I think she's the mother of social workers. We just adore Senator Bernard, and we are just grateful that, she has paved the way forward for many of us, regardless of your racial identity. She is just that person who is extremely busy, has a ton of responsibilities, but still makes time and treats you like your own unique individual. So I too would just like to extend my gratitude and profound appreciation to Senator Bernard. And I'm just extremely grateful. In terms of, this question about how we can come together as Black social workers to support one another, I personally understand, the pressure that is associated with being in a profession such as social work that is, dominated by non-Black individuals. There are many moments where you remain in silence in a group, in group conversations, because you feel at times that you'll be outnumbered due to your differing ideas or diverse perspectives that usually have like a social justice lens. And then it leaves you, or even I could say for myself, sometimes you tend to internalize this experience and carry this burden for however long that may be. And this tends to add to the intergenerational trauma often experienced by people of African descent. So in relation to this, I believe there needs to be more opportunities such as this, or a caucus where Black social workers can talk about the various trends and themes that they are noticing in the social work profession. And most importantly, we need to be there to support one another, not only during times of crisis, but all the time. I cannot say enough how delighted I am to be on this panel with social workers who I've mentored and have mentored me during my career. So in short, I would like to say as a closing note, pay it forward, take this time to reach out and connect with your community, be a voice for the voiceless, and know that it's not by accident that you're here in these roles, but you earned it.
Thank you so much, Allison. I love that last point. We need to carry that with us, that we're here, we're of value, we're of worth, and we earned where we are. And I don't know if anyone's been watching the confirmation hearings with Judge Jackson. There's a moment where Senator Cory Booker said the same thing to her, that you earned this. Remember that you earned this, in the face of everything she was experiencing from the really unfortunately racist commentary she was getting. So thank you for bringing that here to us again and reminding us. We need that constant reminder and validation that we're here because we are of value, we are worth it, and that we earned this. Thank you so much, Allison. And next up is Alicia. So how can Black social workers come together? How have we come together to support one another?
Mm-hmm. So speaking to what Allison had said, there is so much, there's so much power to connections and relationships, especially when it's with like-minded people. So I think supporting those who look like you, who want to do the same things as you, is extremely important. I'm really excited about this association that's coming to Ottawa, and taking a couple of young birds under my wing. Making those connections in Ottawa are going to be really important because, it's important to see others that look like you in specific areas of social work. Before I went into a clinical role, I had not seen many Black social workers in this role. So when I got there and had seen one, it gave me, I guess I breathed a sigh of relief. She took me under her wing and showed me the ropes. And in that, I am forever grateful to her. And I owe a lot of my success in the role that I am in to her. And to pass that forward to someone who might want to be a clinical social worker is really important to me. So with this association and the next generation of Black social workers coming up, it's going to be really important for them to make connections and reach out to those who are in the field that you're interested in. Yeah.
Thank you so much, Alicia, and for sharing what it was like for you to have that mentor in your life and what it meant to you as a recent or new social worker, and how much it means to hopefully share that with the next generation. And I was looking at Allison because perhaps there's a field education opportunity for you to support some Black social work students in your work. And last but not least, I will pass it on to Jamila to wrap up this question for us. How can Black social workers come together, or how have we come together to support one another?
Thank you for the question, Yusra. I also wanted to echo that I look up to Senator Wanda Thomas-Bernard. Every time that I see her in the same events, I'm always running and sitting beside her and asking lots of questions, and I go home feeling very inspired. So thank you for your guidance, Senator. You might not know this, but you're one of my biggest mentors. Also, the Afrocentric paradigm talks a lot about community as the core and the foundation of who we are as a people and the work that we do. And as social workers, I think that is something that we need to pull back in professionally, personally. It is really important to immerse yourself with folks that can, listen to you, create safe space for you to be authentically who you are. One way that I have with my own small capacity is to basically start a Facebook networking group for social workers here in the Ottawa region, and it's open to Ottawa and the folks around the Gatineau area. So myself and another social worker, Lorianne, basically admin the group, and we open it up to professionals, but then also open it up to students. So students who want to become social workers or who already are in the process of becoming a social worker will send us many private messages to, pick our brains and ask questions. And honestly, for me, I can speak for myself, it is such a joy to just, listen and hear their passion, because I think most of us go into this work because of the passion to help, or because we've experienced so many injustices in our lives that we're like, you know what, I want to make the world a better place for myself, for the next generation, and for, other people who maybe have experienced what I have experienced. So that creating that space to mentor and coach and guide and, listen to folks, I think that is really helpful. I'm excited and really hopeful for, an Ottawa branch in terms of the Association of Black Social Workers. I think that would be amazing. Another thing too, I wanted to give kudos to Allison because she's been doing this work too. When I was working at Jack Combit, she always called me, she's like, Jamila, I need you to take a student. I need you to take a Black student. And it is really important. And I really appreciate that, because I had the opportunity to provide an experience for an upcoming social worker. And we were just authentically ourselves in that space, learning. And I would challenge her all the time. And she took it because she's like, I get it. I get where you're coming from. And I'm like, okay, so what if this were to happen? And we would do a lot of scenario questions and just to, to learn and to practice. And I would send her out in the field and for me, I thought, oh my goodness, maybe I'm a bit too harsh and just throwing her right in. But I would check in and she would say, this is actually the real deal because I'm being out there. I'm actually acting like a social worker and not just a student. And she would, have conversations with me and say, I really appreciate this type of mentoring. I think that is really important. I wish I had that as a social work student. I didn't. I think I don't think I even had one social work professor that was Black. So I know that it is really important to have these folks who can, create spaces where they can mentor us and coach us. In my current role at the BGC Ottawa, when I, go to different clubhouses, I make sure I spend time talking with the frontline staff and getting to know them and, asking about their aspirations. And many times I would hear folks, they'll ask me, what did you do to become, what did you do in school to do this job? And I would say, oh, I'm actually a registered social worker. And they're like, really? Like social workers can do this stuff, like they can be like consultants and they can do policy. And I'm like, yeah, and I have to use very simple, relatable grammar in order for, them to see that they can actually do this as well. So I think that is really important because even being with youth in the space where they're maybe having programming, they would always ask me the same question. What did you do in school to become in this role? And I will also share that. So I hope that, we are all able to kind of spread the seeds and support in the different capacity that we have in the different spaces that we occupy. Thank you.
Thank you so much, Jamila. And absolutely, you spoke to some of the key elements and specifically around that communal care. We often hear about self-care and we profess that, but really what we're hearing now and what we've all supported one another with in our relationships and our building of mentorship and building relationships with youth and students is about that communal care. So thank you for naming it and putting it out there. And for everyone for recognizing Senator Wanda. It's my turn now to share what Senator Wanda means to me and what she means to all of us, and just to echo what all of you have said. We're so delighted and honored to be again sharing a stage with Senator Wanda. She's our mentor, she's our elder, she is a mother, she supports us so much and has been in many of our lives for the past years. And we really, really love you, Senator Wanda, and I hope that you feel it from your screen, how much an inspiration that you are, how you're our mentor, how you're our elder. You're really a guiding light for us, and we know what burdens that you carry as the person who paves the path. And we really want to express our gratitude to you, as we do for all of our elders and our forebears, that we share how much we care about you and how much you've brought into our lives, not only as social workers, but as human beings. So thank you so much, Senator Wanda, and for continually to support our events and to coming together with us and supporting us privately as well, as I know you do for me and for others here. And so for those of you in the audience who are meeting Senator Wanda for the first time, likely not, but I will go ahead and read her bio so that you're familiar with her amazing work. Senator Wanda Thomas Bernard is the first African Nova Scotian woman to be appointed to the Senate of Canada, representing the province of Nova Scotia and her hometown of East Preston. Senator Bernard champions issues impacting African Canadians and people living with disabilities. She's particularly invested in human rights, employment equity, and mental health. Through her involvement in community projects, her social work career, her time with Dalhousie School of Social Work, and now her work in the Senate, Senator Bernard has maintained a deep dedication to social justice and racial justice. Senator Bernard advocates for reparations for the historic and continued anti-Black racism impacting the lives of African Canadians in her work. And so now, at the close of our event, I will pass the mic to our esteemed elder and mentor, Senator Wanda, to close our event.
How do I even begin to try to close this event? This has been an hour and a half, practically, of deep listening for me. And I've been so moved, so humbled, and so privileged to be in this space with you, with all of you today. I've heard so much from you today. The need to work with allies, the need to celebrate our successes, the need to be open for the possibilities of where a social work career will take you. Guess what? I'm a social worker moonlighting as a senator. The racism, the everydayness of the racism, whether it's direct racism from clients, students, when we're in the classroom or as academics, or in the community, the racism, but the racism doesn't stop us or define us or limit us. We are limitless. We are absolutely limitless. And part of that comes from our deep commitment to give back to our communities, to lift as we lead. And you are all amazing leaders. To be mentored, but also to mentor. To be inspired, but also to inspire. To commit to self-care and healing so that the racism doesn't penetrate our spirits and our souls. To rise above it because we are working with the most vulnerable of our communities. Race does matter. Representation does matter. Countering racism through our agency and our advocacy does make a difference. Reducing barriers, challenging systemic racism, increasing awareness in our communities, awareness around mental health. Think about it. The everydayness of racism is a mental health issue. But those who are working in mental health don't know that. So how can they even begin to help us deal with the impact, the trauma of racism, the impact on our mental health? I am just so impressed with all that you have shared here today. Absolutely impressed. Yusra, you did an exceptional job moderating this panel. Princewell, thank you for organizing it and picking up the mantle and running with it. Allison, it's so lovely to see you. I know you're on leave, and here you are. Even while you're on leave, here you are, sharing with this group. Alicia, as a young woman, you shared a story about your early work in mental health that was so similar to my own, which happened about 45 years ago. I felt your pain as you shared that. And Jamila, one of my favorite organizations is actually the Boys and Girls Club. As you know, I was on the national board for some time. I love the work of that club and love the work that you're doing. When I came to Ottawa, now almost 6 years ago, if you can believe that, I had three things that I wanted to do. I wanted to make a connection with the Canadian Association of Social Workers. And we have. And it's wonderful. I enjoy the work with CASW. I helped broker a stronger connection between CASW and the Association of Black Social Workers in Nova Scotia. And that's wonderful. I also reached out to Carleton University. That was number 2, because I wanted to take students. And I thought, Carleton's right here, let's reach out. I had prior connections with Carleton. That's where I met Allison. And I've had a student, sometimes more than one student, every year since I've been in Ottawa. And I know that those are really good learning opportunities for every student that comes into our space. And then the third thing I wanted to do was to witness an association of Black social workers in Ottawa. Where are the Black social workers in Ottawa? Having all of you come together today, for me, is a reminder of just how important it is for us to come together. And just to correct some of the information that Principal shared, I wasn't the founding member. I was one of 4 founding members. The idea wasn't mine. The idea came from Maxine Prevost-Shepard. She had come from Montreal. The Canadian group started in Montreal back in 1977. That's 45 years ago, 1977, but they only lasted 2 years. Maxine was a student in Montreal. She brought the idea of the group to Halifax. I was one of the first people that she invited, and we invited others, but we got 4 committed people. I was the only registered social worker in the group. The others were community workers, and our organization is open to social workers and community workers, community service workers, because we feel that's important, because often they are the people who are closest to some of the people in our communities. But the Nova Scotia group has been going now for 43 years. 43 years. So, Principal, you are right. I think we have a very solid reputation now, certainly locally and regionally, and we're building that nationally. And we certainly want to help other organizations build across the country. There's a group that's formed in Alberta. Guess what? They started with 4 women who attended a talk I gave at the University of Calgary. They've run with it. They now have close to 40 members. Absolutely amazing. So I don't know what will happen from here, but I do know this, that whatever you do, whatever you commit to doing, I will support you in any way that I can. And I absolutely love the name that I've been given today. I think it was Allison who said this, the mother of social workers. Oh my goodness. I've never been called the mother of social workers, but I'm going to take that as a gift from you today. It absolutely is a gift. Whatever I can do to help you connect and move forward, I want to do that. So thank you for inviting me to join you today and to just share some reflections on what I heard from you in this, what I consider a very sacred space, as we bridge Black History Month, Social Work Month. This is our time. This is our time. Thank you.
Thank you so much, Senator Wanda. We're all applauding, and we're so grateful that you joined us today. You shared your reflections. You gave each of us a moment of recognition, and we hope that we were able to do that for you as well, to recognize and really express our gratitude in terms of how much you mean to us and mean to this community, and really mean to social workers across Canada and beyond. I do know that we have a few questions in the Q&A box, so I'll go ahead. I know we're close to time wrapping up, but I do want to honor those individuals who have asked some questions. So I'll just ask the question. If anyone in the panel would like to answer, please feel free to do that. A few are related to university settings, so I'm looking to you, Allison, but everyone can share. So the first question from Cassandra. What an incredible panel. My question is, how can we better advance and elevate these conversations, especially within institutions or organizations, and also with policymakers? Thank you. Would anyone like to speak to that specifically?
Well, I can start off with policymakers, then we can move on. For policymakers, I think it's every organization need to have a corporate diversity and inclusion plan. And part of that plan should be how to advance workplace racial equity within the workforce. And so if we know of any Black person that is in a leadership position within an organization and they don't have that already, it's an opportunity to share with them and say, what are you going to do? Are you going to take this to your organization? There should be even white allies that we know within organizations. We should be comfortable to share with them the need to have corporate diversity and inclusion plan and a specific area that addresses workplace racial equity as well. So that's where we start off with the policy piece, I would say. And also, most organizations are now developing quality on racial discrimination. I know a lot of organizations had quality policies on equity, diversity, and inclusion. But after the death of George Floyd, the murder of George Floyd, a lot of organizations in North America are moving towards developing racial equity policy now. So these are something else. I would hand over to Allison, I think. Thank you.
Yeah, thank you so much, Principal. Just to kind of add on to Principal's comment, I think from an institutional perspective, a couple of things that we're doing as a school is that it's always important that, you have the policies that really reflect, the equity, diversity, and understanding of inclusion within the classroom. And one of the approaches that we have taken as a school is just ensuring that this language is very clearly articulated in a lot of our curricula. So whether it be in the mission statement for the school, as well as in course outlines, that's something that's definitely been helpful in clarifying, our position when it comes to advancing EDI, particularly for groups that have a history of racial discrimination. In addition to that, I think it's also important, and one of the things that we're doing at the school is that when we're talking about conversations around anti-racism and anti-Black racism, we also have students involved in these broader discussions. And we want to ensure that any policies or any changes or any initiatives that are being implemented truly reflect the vision of the students as well as the faculty. So having, these spaces where we can have these honest conversations that reflect on the experiences for the students as well as for the faculty is quite integral. And it helps to create that sense of belonging and understanding. And so these are some of the things that we are, proudly doing currently at the School of Social Work.
Thank you very much, Allison and Prince, for that. I think you spoke to the layers of work that are required to really have these conversations. So informally with one another, with your colleagues in classroom settings, hopefully advocating towards management, but then more formally in the case of trainings, in the case of actual courses and things like that. So we will move on to the next question from Nafisa. Is there information about Black clinical supervisors that is available for new MSW graduates coming into the mental health field? So given our clinical social workers who are here, Alicia and Jamila, I'll let one of you or both of you answer that question. So is there anywhere that Nafisa or anyone interested can access information about Black clinical supervisors?
I could start. I'm not sure exactly where you would go to. I would say if you're in school currently, maybe speak to your practicum coordinator. They might have information on that. For me, I am part of a group. It's the Ottawa Region Social Workers Group. Folks there would actually, share with everybody if they are supervisors, and then you can identify if maybe their skills is something that you would like to learn from. I think for me, I've kind of immersed myself in different networking groups to figure out who are the people that I can bring to my village, basically. I want them to be part of my village. So I have to identify who they are, and I have to put myself in those spaces. I'm not exactly sure if there is a list. If Alyssa has one, I would be very happy to, hear about it. But yeah, I think, asking questions and reaching out to different groups that are available currently, you may be able to find some people there. There is an online, there's a website, I think it's called Black Therapist Network or something. There are folks there they're all African, from the African diaspora, and they would also list if they are clinical supervisors as well. So you can use that resource.
Can I just jump in? Oh, sorry, go ahead. I was just going to say, and that would be another value of having an association, because one of the things we do is having a master list, and we know where people are working. And it's a really wonderful resource for students or, people new to the area who are coming in and looking for someone in particular fields.
Jamila touched on different areas, but I had visited, I believe it's called Psychology Today, if I'm not mistaken, and I've actually filtered it to try and find someone in my local area, and had reached out to a couple of therapists there to see what their qualifications were, and to build a small community through that as well.
Thank you, Jamila, Alicia, and Senator Wanda for sharing. I know, on top of what everyone already shared, when I was in a clinical setting, we did have what was called a community of practice that existed in certain centers. And because it was so frontline, so community health centers, some organizations that serve newcomers, of course, many of us do work in those settings. So there are some informal relationships that were built that way. So if there are any community of practices that exist with local agencies or organizations, that might be another way to seek out some Black clinical supervisors, in addition to what was already shared. And as Senator Wanda said, we hope to get this off the ground to really make it more formal for all of us to have access to clinical supervisors. The next question is from Megan. So Megan asks, I'm curious what the panelists believe need to change in the vetting/recruitment process for getting higher numbers of Black students in MSW programs. So I will start off with Allison. Yeah, go ahead, Allison.
For me, one of the things that I'm very passionate about is around recruitment. That, if we are kind of engaging in the same traditional recruitment where we send out emails and we utilize these massive listservs and we just press the send button, we're going to continue to have the same results. So I feel that there needs to be more of a push towards universities doing the active outreach, going out into communities, establishing or building those relationships with communities, particularly, Black, Indigenous, and racialized communities about the social work profession, the different pathways to the social work profession. Because a lot of times when I do outreach presentations in the communities, and one of the first questions that I ask is, when you think of social workers, what comes to your mind? And you'd be surprised some of the responses that I get. And predominantly a majority of the responses are around within the child welfare context. And people, for some reason, youth just have this idea that to be a social worker, you're pretty much going to be only dealing within a child welfare context. And that's quite the contrary. Where as we established today here on the panel, there are so many different pathways to the social work profession. And I think there needs to be more opportunities for educators, clinicians to do that outreach, to further advise the community on the greatness of this profession in itself. Because I can recall when I was in my last year of high school, I had no clue what I wanted to do. And through one of my high school mentors who said, you would be a fabulous social worker. And I'm like, what does a social worker do? And even at that time, my knowledge on the social work profession was rather limited. So I feel to kind of address this gap when it comes to the low representation of, Black, Indigenous, and racialized students in, the social work education field, we need to do better in terms of recruitment. And also, once we've understood, the various aspects or elements to recruitment, there also needs to be key infrastructure in place within the schools to support and retain those current students.
Thank you so much, Allison. I think you answered the question perfectly in speaking to how the traditional or more historic ways of recruiting students doesn't necessarily work for our communities, and taking that communal approach and a really unique approach to bringing in the students that come from our communities. And also, as you said, that retention and supporting students when they get through the door is so, so crucial. So thank you for answering that. Does anyone else have thoughts on that question before we move on to the final one? Okay, so the final question comes from Beth. Are there networks for peer mentorship? I think we touched on that already, but I will just shout out Jamila's Facebook group that she co-leads with Lori Ann, who's another amazing Black social worker in Ottawa, which is called Ottawa Region African, Caribbean, and Black Social Workers and Social Service Workers Network Group. And correct me if I'm wrong, Jamila, that's an open group that people can join on Facebook. Yes, okay. And does anyone else have any suggestions or answers for Beth around networks for peer mentorship?
Well, as soon as we get the Association of Black Social Work Ottawa chapter, that would be a great network for peer mentorship, as Senator Wanda had said. So hopefully we're able to start that association as soon as possible. That's kind of what I would say.
Likewise, we hope so too. And of course, we're all here to support that and are part of it. And perhaps also, Beth, in terms of the university or college, if you're a student there, there are a lot of informal just networks and connections that exist for Black students and peers. So that might be another way to do that. If you're in high school, there's the Boys and Girls Club, Big Brothers Big Sisters. There's so many local organizations, if you are in Ottawa, that you can reach out to. And you're also welcome to reach out to any of us and any of the people on the panel here today to support you in finding some peers and connecting in that way. So those are all the questions. Thank you so much for everyone in the audience who's joined us today. Thank you so much to our amazing panel, Prince, Allison, Alicia, Jamila, for sharing your experiences, for being honest, open, and brave, and talking about what it's been like for you as a Black social worker, and also offering some words of hope and wisdom. And of course, thank you to our esteemed mentor and elder, our beloved mother of social workers, which I'll now be calling you that every time I see you. Senator Wanda Towers-Renard. Senator Wanda, I know you already closed our event so beautifully. Are there any other reflections you would like to share to officially wrap up and close for the afternoon?
Actually, I'm going to ask Alex to come back just to let this audience know about the event we have coming up on, I think it's Tuesday. Or maybe it's Monday. You see, I don't even know the day. I just show up. Allison, do you mind? Because I think it would be good to let this group know, and maybe even put in the chat the link for anyone who may not have heard about it. While you're moving forward to come back on and maybe just gather the link, I'll just say that we've been doing an event with CASW. I think there's 4 or 5 social workers who are actually senators or MPs, and we've had this event called Social Work on the Hill for the last 4 years because of COVID. We've done it online. So we had an event a couple of weeks ago. It was a wonderful conversation. Myself and Senator Nancy Hartling from New Brunswick. And on Tuesday, we were invited to invite a student to join with us, and the focus was on students. I invited a student that I hadn't taught, that I met at Carleton at the Black History Month event, at Carleton's Black History Month event back in February. I was so impressed with this young woman. when I was asked if I had a student that I'd like to invite to this wrap-up event, I invited her. Her name is, I think it's Jamila. Maybe she's even on here. I don't know.
I think it's Daniela.
Okay, thank you. I better get it right for our event. So Allison, can you let folks know about that event, please? Or Alex, I'm sorry.
Sorry, I didn't want to interrupt there. So we are hosting an event, another event in collaboration with the Association of Black Social Workers that will take place, Senator Bernard, you are correct, on Tuesday. And that one is going to be on Zoom, so it will be a different format. I'm also going to, in 1 second, pop in the chat the conversation we were just having around the other event we have for National Social Work Month, where it's a conversation with students. So if any students are attending here, we would love for you to attend that event as well and be able to provide your insights and reflections. That would be so wonderful. On a side note, I just want to thank this incredible panel for providing such thoughtful and incredible remarks around National Social Work Month. I'm in total awe, and I am so appreciative of the work that you do. And thank you for being a part of CASW's continuing ongoing learning and journey in terms of being better allies and better social workers. Please share this recording with your peers and your colleagues and your friends, and we will send you a reminder email after it's done. On that note, I'll pass it back to Yusra, but just a massive thank you.
Thank you, Alex. So looking forward to that event coming up and reflecting that again. Thank you everyone for joining us and spending this afternoon with us. Thank you panelists. Thank you Senator Wanda. We express our sincere gratitude to all of you, and we hope you have a great rest of your evening. Thank you for spending some time with us this afternoon, and we hope to see you again. Stay safe, everyone, and have a good evening. Goodbye.
Bye.